Do you know you can avoid all these diseases? But how? Let's know from the specialist himself on today's Cardio Kidney Metabolic Talk Show. A very good morning to one and all present over here. I am Dimple, your anchor and host for today's episode of Cardio Kidney Metabolic Talk Show. Therefore, to educate us more about diabetes as well as the prevention and treatment of diabetes, we have with us very renowned MD doctor with keen interest and specialization in metabolic diseases. He is none other than very respected Dr. DrJKishore. Therefore, I would like to welcome him. Welcome, Dr. DrJKishore. Good morning.
How are you?
I'm fine, sir. Thank you so much. Today, the weather is really good, and seeing you, I'm getting really positive and energetic vibes.
Really?
Doctor, we have heard that diabetes is a lifestyle disease. But if we do regular walking, exercise, apart from focusing upon our diet, then we can prevent diabetes and other diseases which are related to metabolism. So, is it true?
Absolutely true. Because lifestyle changes is the foundation of most of the metabolic disorders. And I think we need to focus on lifestyle changes. So hence, exercise is an integral part of it.
Okay.
So we need to really look at it.
As you mentioned, exercising, walking are really very, very important. So, let's walk and talk and discuss about diabetes and management of diabetes. So, sir, as we are talking about the journey of life, I would like to ask you to kindly say a little about yourself and what inspired you to become a doctor and what motivated you to choose this specialization.
Well, the motivation started right from my school, from the time when I was studying class 9. So that's the time I decided I should become a doctor. And my special interest in the field of internal medicine has been very strong. And hence, I did my internal medicine from SAB Medical College, Cuttack. And I have a special interest in certain endocrine and metabolic disorders. And that's how I came to be treating patients of diabetes and other various other metabolic disorders. And obesity is also a part of it. And now we see that a lot of obesity is there. So that's how my journey has been really very good. In fact, it has been so enriching and so educative. And I hope I have lived to the expectation of most of my patients. So,
Thank you, doctor, for your words of wisdom. But now, my first question to you would be, as the tagline of our show is, when we met for good health, so which lifestyle have you adopted for remaining such fit even in your such busy schedule?
well, I would say the mantra is basically on diet, because in exercise you can hardly work out roughly about 250, 300 calories, but diet you can modify to the tune of 500 to 1000 calories. So my basic mantra is be very focused on your diet, and whenever you are not busy, I think doing a bit of physical activity could be an additive effect, and that's how I keep myself fit to this extent at this age.
As we both are having tea, there's a question in my mind. What basically diabetic patients do, in the morning they consume tea with less sugar, but throughout the day, entirely they are not aware about what they are consuming and they take it very lightly. So, what's your take upon that?
Yeah, it's very true. To that extent, I'll tell you in the lighter vein. We had a professor. So when we used to have our seminars, so he used to say, "No, I'm not having tea with sugar." But then he's given a sweet rasgulla, and then he says he's going to. He said, "Squeeze it properly and give it to me." So that's the concept. People think that is it. And then another the funny incident is that people tell you, "I have this much of rice, just one roti." So a friend of mine had told me, you ask them what they eat in between the meal, which is much more than what they really say. Diabetic patients normally underreport the amount of food they eat, they overreport the amount of exercise they do. That's the way it is. So we should not go by what they say. So you have to ask them to maintain a food diary of whatever they eat. And that's the way you can really know what they're going to consume.
Dr. Kishore, as there are increasing cases of heart diseases as well as kidney diseases, from your side, which advice would you like to give to the patients so that they can follow and lead a healthy life?
The only advice what I give to the patients who have heart disease and kidney diseases is to be in regular touch and monitor your disease. Try to see that all your parameters in terms of cardiovascular risk enhancers and kidney risk enhancers should be under control.
Okay.
So we need to have the proper control of your sugars, proper control of your hypertension, reach your cholesterol to target levels, which will prevent cardiovascular problems, and have a healthy lifestyle, because these are the things which normally help you to prevent developing cardiovascular and chronic kidney disease.
Definitely, sir. Your tips are really helpful and easy to follow. But along with that, Dr. Kishore, I would like to ask how diabetes damages our kidney or heart or both.
The damages which are caused in terms of heart are basically your coronary artery diseases, which as we call is myocardial infarction or heart attacks as the common man knows. And besides this, now the latest focus is on having heart failures, which was neglected. And now we have a greater number of patients who have heart failures. So that has overcrossed the number of people who develop coronary artery disease. So heart failure is another very, very important complications of type 2 diabetes. And in terms of kidney, it is basically a chronic kidney disease which happens. And we find a lot of cases now having chronic kidney disease requiring dialysis, renal replacement therapies, and transplants. So that's the basic idea.
Sir, you explained it really very well. It is considered that women suffering from diabetes have a more chance of suffering from heart diseases. Is it true?
Yeah, definitely. In our country, the women are the neglected not, and they themselves feel that they can take the treatment a little later when rest of the family is treated. So hence, the women are the most suffering a lot. Fortunately, now the scene has changed, and a lot of people now, the women are taking the advice in a very early phase of the disease, and a special reference to people, the women in the postmenopausal state, because they have the same risk of developing heart disease as a man. So hence the women stand at particular risk of developing cardiovascular disease.
Dr. Kishore, what parameters should we keep in mind while checking as well as monitoring the cardio-kidney metabolic health?
The few parameters what we need to check is basically for diabetes, you have a fasting blood sugar, you have a postprandial blood sugar, you have a HbA1c, which is a glycosylated hemoglobin. You need to look at the lipid profiles, because the lipid profile targets have to be met basing on the risk of the patient as per his parameters. Second, for the kidney disease, you need to do a urea creatinine or sodium potassium and uric acid to even do for the urine albumin creatinine ratio, because they're the subtle, the first indicators of renal involvement. And even we need to do a routine ECG, echocardiogram, and an ultrasound. I think this is the few parameters we need to do, and it's a must, because the cost of the test will not exceed the cost of treating a particular problem. So we need to do that.
Doctor, you have simplified the complex terms, so thank you for that. Now I would like to ask, can the same diet be given to the diabetes as well as heart patients, or if there are any specialization of diet or special guidelines, so kindly guide us.
Actually, if you look at diabetes is a cardiovascular risk equivalent, which means that a patient of diabetes is taken as having a pre-existing cardiovascular problem. So basic treatment of these two disorders will be the same in terms of lifestyle as in terms of food, whatever you have. The only difference being that in diabetes, since the sugar levels are high, I think we need to control your diet in terms have a diabetic diet, and otherwise the diet advices are the same.
Dr. Kishore, diabetes and high blood pressure cases are rapidly increasing in India. So, is it true that uncontrolled diabetes along with high blood pressure in an individual increases his or her risk of suffering from cardiovascular diseases and chronic kidney diseases?
Yeah, definitely. You're right, absolutely. You have hit the nail on the head that uncontrolled diabetes and uncontrolled hypertension are the two drivers of a cardiovascular disease and even chronic kidney disease. So, hence, controlling these two, along with control of various lipid disorders, are the main factors which we need to do to prevent development of coronary artery disease or chronic kidney disease.
Dr. Kishore, what are the symptoms of diabetes and does lifestyle and medicine play any significant role in treatment and management of diabetes?
The predominant symptoms in which the patients come to us is with weight loss, weakness, tiredness, increased hunger, increased urination, and delayed wound healing or infections. These are some of the common symptoms in which the patients come to us. And definitely, lifestyle and medications have an impact on the treatment. And while lifestyle is the basic foundation, I think medications can help a patient achieve what is not done with pure lifestyle. These two are the pillars of good diabetes control.
Sir, you have been treating diabetic patients from a very long time. Therefore, are there any cultural impact of diet, lifestyle upon the patients?
Definitely, our country is a multicultural country. So, culture in terms of food is very, very prominent. And while the carbohydrate intake of most of the places, most of be it northeast, southwest, is about roughly about 65%. And but still, there could be subtle differences in the type the food is cooked and the type of oil you have used. So hence, cultural differences does have an impact, and the local physician should be aware of this cultural differences. And we have to make the healthy choice basing on these cultural differences. So you really cannot put a particular diet of the south onto the north. So cultural, definitely it has an impact. So I think we need to know about it.
Sir, we have noticed that since past few years, the cases of diabetes have rapidly increased in India. So, as per you, what are the reason behind that?
I think basically we have a predominant genetic predisposition. Adding to that is the development which has occurred over the period of time, and we find a lot of affluence in our country, and that the younger generations are now more onto very unhealthy diet in terms of eating fast foods and leading a very sedentary lifestyle. So hence they are not up to the fittest level in terms of lifestyle. So hence, most of them tend to have, and now we have people with the younger ages having type 2 diabetes. So hence, I think this is one of the reasons in which affluence could be a big factor.
Dr. Kishore, what are the tests that can be done to detect diabetes? And can it be done at home? If yes, then what impact does it hold on the treatment? Kindly educate our viewers on that.
Doing test for diabetes is very simple. It can be done both in the labs as well as in the house, and it's not very expensive. So you need to do actually a fasting post glucose blood sugar, which is roughly 2 hours after having specific 75 grams of glucose in roughly 300 ml of water, and then you test exactly after 2 hours, and even do a HbA1c, is called as glycosylated hemoglobin. These three parameters will help you to decide whether you have diabetes. And once you know you have diabetes, you can go to the local physician or consultant and see that he gives you the best of the advice, and just follow the advice. This is very, very important.
Okay. Dr. Kishore, the major arising concern is obesity. So, could you please mention what is central obesity, why is it increasing, what are the impacts, and how can we prevent it?
Obesity has been recently come into a great focus because initially we were not talking as much about obesity, and central obesity in particular with the Indians, we tend to have a greater amount of central obesity or more of visceral fat, that is the fat content in the organs, and that's the area in which insulin resistance occurs, and we tend to have diabetes. So controlling of obesity through diet and exercise is very important, and having obesity can also cause various other diseases, metabolic disorders. So hence, we need to have proper control on your diet and exercise. We Indians were called as thin fat Indians because we have the same BMI, but in spite of that, we have a higher amount of visceral fat, which is not advisable for any person. So we need to control, and the best way you can do it is through your diet and exercise.
Dr. Kishore, can the same diet be given to the patients of diabetes as well as heart disease, or are there any variations and specific guidelines? If so, then kindly educate our viewers upon that.
First to start to say is that diabetics is taken as a cardiovascular equivalent, by which we mean a patient of diabetes should be considered as having a cardiovascular problem. Hence, the diet-wise between these two, there's not much of a difference. The only difference between a diabetic and non-diabetic is that the diabetic patient will look at his sugar values, blood sugar values, and that's what has to be controlled. And otherwise, rest of the parameters in terms of hypertension, in terms of cholesterol, and in terms of lifestyle, they are the one and the same. So they can share a very common food. So they don't need to have anything separate.
Okay, thank you so much. Dr. Kishore, what new developments have been made for the treatment of metabolic disorders which would be beneficial to the patients? And is there any involvement of artificial intelligence?
I think recently we have seen the emergence of various new molecules like SGLT2 inhibitors. We have GLP receptor agonists, and those things have changed the way we treat diabetes because they are the ones enough trials have been conducted where they have proven their benefit in terms of cardiovascular, in terms of renal, in terms of various other metabolic disorders, including obesity. So these two molecules have changed the way we are treating diabetes. Regarding artificial intelligence, I'm not too much aware, but I think at some point this will also tailor make the treatment for a specific patient once you put the input and the uh, specific treatment for that particular patient can emerge. Besides that, artificial intelligence has been used like you have in techniques in medical like 3D printing, which is in which you can devise a lot of uh, implants and other things, which is not relevant to this subject. But I think artificial intelligence also has been used in various diagnostic procedures like glucose monitoring and other things, so which you have in your smartwatches. So I think they're all based on AIs. So AI is the future. I think that will be put into use in the most beneficial way for the treatment of patient and for managing diabetes and various cardiovascular disorders.
Okay. Dr. Jay Kishore, last but not the least, from your side, what social message would you like to deliver to the viewers so that they can maintain a good cardio, kidney, metabolic health and lead a happy life with their families?
So you have rightfully put it first. You have to be happy. You have to be in a very positive state of mind. You need to have an adequate rest. You need to look at your lifestyle modification in terms of having adequate exercise and having the required amount of calories what you need as a patient for your body weight, and take care in avoiding food which could be harmful to your system. So please, all of you, take care of your health in terms of leading a very balanced and very good lifestyle, and monitor your disease. Even if you have, you need to monitor. You cannot just sit and then expect that everything will happen on its own. So you have to have a great impact in terms of monitoring your disease.
Thank you so much, sir. That was
Thank you.
really
It
very,
was my
very.
pleasure. Thank you.
Thank you, viewers, for staying connected and to get more information about diabetes and its management, you can join this movement by logging into our Facebook page named as Cardio Kidney Metabolic Talk Show. Cardio Kidney Metabolic Talk Show is also available at YouTube and Instagram. That's all for today. Thank you so much. Till then,